Hello, my name is Ruth Gutierrez, and I work as an instructional designer in the Professional Advancement and Leadership Institute at Children's Health System. Today's presentation, Patient-Centered Communication, the framework of the Language Service Department, come after several months of work. The, when the Department of Clinical Education ask our team to develop a project to optimize the impact of the Department of Language Service in our organization, we knew that we were going to go through a beautiful journey of cultural awareness, overcoming, sorry, language barriers and finding common ground, among the differences inherent to an organization that prides in being diverse and effective, as our organization is. The desired outcomes for today is understand the instructional design process used for this project, explore the cultural, ethical, and legal consideration of the project, examine the learning and performance outcomes, look over delivery methods and instructional strategies, and of course, the project timeline overview. Our project was developed with the purpose of creating an effective training for children's health. I mean, this organization is not only a children's hospital, but a healthcare conglomerate that employs more than 9,000 professionals and serve a diverse community. One of the most unique traits of this organization is their language service department. And this department employs more than 150 certified medical interpreters, and they are dedicated to serve patients and family across the organization. However, it started to be observed a trend of disregarding the policies and protocols about using interpreters. So when this started happening, several departments joined in the quest to find the gaps in the process. What was happening? Preliminary findings discovered that one of the gaps was that some of the employees did not know about the department, and other ones didn't have an exact understanding of the significance, importance, and the legal considerations involved in medical interpretation and the use of the language service department. Also was detected an over-reliance on costly video interpretation when other better costly wise options were there. Language interpretation, and this is something very important. When we went through the process, we went through a little bit of history. Language interpretation and translation is something that is ancient since language was created, I guess. So for thousands of years, there has been interpreters and translators that help in the endeavor of building bridge and communication gaps due to language. Actually, if you think in history, kingdoms and alliances were formed thanks to the endeavor of interpreters and translators. Medical interpretation is a kind of a relative new field and is used in healthcare to facilitate communication between patients and healthcare providers. Nowadays, it's available in many countries, and also there is interpretation and translation for many different languages. Interpretation also is something important for the deaf community to interpret American Sign Language and other sign language in another language, in another languages, to say that way. because not all sign language are American Sign Language. So interpreters are important for that as well. One of the most important aspects of this is that provide a real-time communication with the providers doing diagnosis, treatments, medical decisions, procedures, patient education, and of course, when they give patients and family members treatments that they need to be followed up at home. It also serves the purpose to convey the accurate message from both parts without losing the context and the cultural nuances that exist. One of the reasons why medical interpretation is considered a specialized profession and also medical interpreters have certification is because the interpreters has a in-depth understanding and knowledge of medical terminology, both in the original language and in the target language. One of the key aspects of children's health as an institution is that is constantly striving in the fact that the population is diverse. Also, their employee population is diverse as well. That is why they extensively work in promoting an inclusive workplace and an also equitable practice. Because the thing is that the reality of the institution is their employee community is absolutely a representation and as diverse of the community that we serve and is constantly evolving and is constantly striving for a better understanding of the changes that occur and incorporating those changes in the appropriate practices. Like I say, the employee population is diverse. That's why there is an understanding of why interpretation is necessary. Also, there are many employees that are capable of speaking more than two languages, some of them three, four languages. So this made our employees more open to receive education about the language service department. They feel more interested to that. Also about interpretation modalities. The medical interpreter profession has a lot of ethical consideration besides being the tool of communication between patients and providers. Also, by law, is a service that cannot be denied and should be provided by the institution. Developing an effective training that gives comprehensive information about the medical interpretation and the legal considerations associated with it, it is important. A person that has limited English proficiency have the right, legally speaking, to access healthcare in their language of choice or in their target language. So moving on, let's talk a little bit. Something that was very interesting for us is to discover that the medical interpreter profession has a robust code of ethics. It talks about confidentiality, accuracy, impartiality, boundaries and professionalism, cultural awareness, advocacy, furthering of knowledge and skills, professional and ethical behavior. And this confidentiality, this accuracy, this impartiality, faithfulness, advocacy, and cultural awareness are part of the legal dimensions that need to be explored in the training program. All these considerations need to be taken into account when producing the instructional design material. It should be simple, but at the same time, it should be explicit enough to give the trainee, the student, the comprehension on why not using interpreters could make the hospital, other providers, and even themselves liable. The politics and protocols that refer to the medical interpretation within the institution are well defined if we think about it. They already exist because just think about this. A well-defined, a well-established department, language service department exists for the last 20 years in the hospital. Therefore, producing a training program does not represent a problem exactly. On the contrary, it is in the benefit of the organization and prevent legal actions and liability. The organization desires to keep a safe and open environment for the community they serve and also for their employees as well. Defining the learning objective of this project were a little bit challenging. Being able to quantify the amount of learning through an evaluation required like a little bit of finesse. One of the most challenging was working in a system-wide survey. Remember, we are talking about 9,000 employees, and also the training strategies. So evaluation during and after the class were able to be developed using strategies that try to simplify the process as much as possible. Some of the training is about the technology that is used for video interpretation, voice interpretation. And this is good because it opens the doors for practical evaluations, which are usually interesting. Since also another thing that since the topic of interpretation is so broad, being able to define the learning objective was very important. It was key to the success because the thing is that this gives the trainees, the trainers, clear understanding of why they will be covering and the course of action, what is expected from them. In other words, it needs to be defined. It needs to be maintained, the responsibility of it, and it needs to have a clear and concise message. So the learning outcomes that were developed, where the learners will summarize the background and legal consideration of medical interpretation. The learners will define the limited English proficiency term. The learners will recall the different interpretation modalities. The learners will demonstrate they know how to use the technology used for voice interpretation. Then we have the performance outcomes. Each performance outcome is directly related to the purpose of developing and enhancing each of the learning outcomes. So some of them, because there were many, so for the sake of time, I'm just going to go through just some of them. We say at the end of the training, the learner will be, in general, able to describe legal consideration, explain why interpreters need to be certified, define different terms associated to medical interpretation, understand diversity, equity, and inclusion in the organizational context, identify interpretation modalities, demonstrate how to use the technology used for video and voice interpretation. These were some of them. Then we go to the delivery methods and instructional strategies. So institution workshop or classes for the professionals that already work in the organization, that are already professional, is completely different from official teaching in high school or college. I mean, what is important is the personal growth and the advancements that are intrinsic in adult learning. And also the understanding that these provide the organization with better trained and knowledgeable staff. This process, however, is not without challenge, because it depends on the proficiency of the trainee in respect of technology and some other difficulties. So every project should be able to overcome or to anticipate these difficulties, and the instructional materials and assessment can be addressed so these requirements are met. The delivery method has been created with the purpose to be effective for the whole organization. The most effective that we found, and that's what we're doing, is a 4-hour Zoom class. That would include active interaction and participation in the chat, polls that are going to be evaluating as we do the class, and some other activities, and some of them include the use of annotate. These polls will be done as the content is facilitated with the purpose of evaluating as we go during the class. And then at the end of the class, the students have to go to Cornerstone and have to take a 25 question test. And some of them is single choice, and some of them are multiple choice questions. This will help us to evaluate individual learning. Also, this assessment will be summative assessment, and these will help evaluate the learning knowledge proficiencies or success of the instructional design of the training. It will be graded, but what we want is for them to do the test multiple times until they are able to reach the passing grade of 80%. About the resources, it will be an online learning platform and integration. Also, after the class, it will be a period in which the instructor will go to different hospital units and do check-off with the devices used for interpretation, so hands-on. And they will use existing emerging technologies like desktops, laptops. We're going to use Cornerstone as a platform, EEDS and SurveyMonkey for the surveys and post-class surveys. We use Asana as a platform in which we put the projects. It is more easy to see it than the PowerPoint for the classes. At some point, we may be using Articulate 360, but we are not exactly sure about it yet. Then we have the timelines. The prototype development timeline is 4 weeks. However, we understand the nature of the medical field that is ever changing and is busy, 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 busy a lot. So we are giving also, we extending this to 6 weeks if it's needed. We don't have a problem with that. We have put into consideration all this. In the training timeline, we are going to have the final review of the instructional material 2 weeks before the first class. Then we have first dry run with only instructors, 5 interpreters that are not instructors that are invited, the manager, the team leaders. Then we have in the second week, sorry, 1 week before the start of the training, we are going to have a second dry run, which will be 15 trainees that are invited. And then we are going to have session 1, 2, and 3. Those will be 3 weeks in which we are going to facilitate. It will be 30 students per class. And they need to do the post-class survey and obviously do the post-class evaluation. 5 days, we are going to see how the post-class surveys are doing, what's the people saying, also see how many people have gone into Cornerstone and do the evaluation, and then start the rounds for the practical test. 30 days after those rounds, at least for the first 3 sessions, should be concluded. Also, people should have gone into Cornerstone and do the test. And of course, as time goes, we're going to keep on checking. We're going to be reviewing and adjusting and being there to be of support to the instructor team. So that's most of what we're doing, and I want to know if any of you have any question, any further question. We're opening the floor for that. And I want to say thank you very much. It's been amazing, and all this process and all this journey and being there and do this with all our team members was amazing. So thank you so much.